everyone, and welcome to Meet the Experts. I'm Dori Soukup, and today we have a very special show for you. I invited two experts for you to discuss when is it enough to have non-invasive treatments and when should you go to the next level and actually have plastic surgery. We get this question all the time. So I invited two friends as well as colleagues and professionals who own an amazing medical spa and plastic surgery center in Pittsburgh, Pennsylvania. And they are Briana Kane and Lynda Lazarro. They have an amazing practice and they serve their community and provide some of the best medical spa treatments and plastic surgery center. I am so excited to have them here with me today to discuss this very important issue and give you insight on how you can make smart decisions and know all the ins and outs and the latest and the best trends that's going on in the medical spa as well as in the plastic surgery center. So welcome, ladies. It's great to have you. I'm so excited that you're with us today.
Thank you so much. We're happy to be here.
Yes. So I have to tell you, they are a mother and a daughter team, and actually Dr. Lazarro is actually the plastic surgeon. So that's what I love about them. It's a family business, yet you get a first-class experience from it. So today's topic is all about how they cater to both of those different types of treatments within their facility and be able to help consumers in their community. So we're going to start first by saying thank you so much for our sponsors. This episode is sponsored by Color Science and also InSPAration Management. So let's go ahead and start first by how did you actually decide, or when did you decide to actually open up your medical spa?
Well, my husband was in practice for years, and he would do these wonderful procedures, the nip and tucks with the face, have a wonderful result, and he would look at the patient afterwards and say, but their skin is dull, they have age spots, sun damage. He said, we're not giving the patient the full experience. And so we were one of the first facilities that actually brought in an esthetician. We started an esthetician in one single room within our main building, and it was basically skincare and glycolic peels, the beginning of glycolic peels then. And that became the staple for all of our patients. Would go through a pre-process where they would get their skin prepped for surgery, and then after surgery, they would continue to maintain it. But the results would be much more gratifying to the patient because they looked great afterwards. Their skin was glowing. They had nice, tight skin, and they didn't have the age spots or the sun damage any longer.
Yeah. And how did it become a full-blown medical spa? How long after you started with just an esthetician to having a full-blown, because you have an amazing facility. So tell us how that went about.
I think it was about 5 years after we had the single esthetician. Then we said, we want to offer them more. We wanted more procedures, more like lasers, deeper skin care. We wanted massages. After facelifts and tummy tucks, he wanted lymphatic massages because that would help the patient in their post-operative care. So we moved in right around 2000, we opened up the spa in Greensburg, which is right next to our main building. And we were there for 11 years before we opened our second location, which is in Pittsburgh, Pennsylvania, offering all the same types of services. But as the years have gone on, we've offered newer procedures, better procedures, anything that can help the patient or the client to achieve what their goal was, the end result of what they wanted.
Great. So Briana, what would you say are some of the most popular non-invasive treatments that you offer in the medical spa portion of your business?
Well, we have a lot of great treatments that we offer. Probably some of the most sought after ones are Botox, dermal fillers. Microneedling is a very big one for anti-aging. And we do have the Cyton BBL laser to do photofacials and help with that pigmentation and skin texture issue. And another one that we do now a lot of is hair restoration. PRP hair restoration is a big thing that people have on their minds that they want to have done now.
So walk us through a process. Let's say I'm a consumer and I've never been to a medical spa, or maybe I have been, but I didn't probably know what was the right path to actually experience the place or not. So what is the philosophy? What should I expect as a consumer when I'm visiting a place for the first time? What is your philosophy that a consumer should go through and expect?
I think at Aestique, our philosophy is when the client or the patient comes in, we offer them a customized skin consultation head to toe. And we talk to them about what are their concerns, what would they like to see happen, and then our experts talk to them about what they feel would benefit them the most. We have a full plan, complete with what the cost would be. A lot of times clients will say, can I just cut this in half? And they'll, the first half of the year, they'll work on one set of treatments, and then they'll continue with the rest of the year. And then they meet with all the different providers to accomplish what their concerns were, as well as our providers.
Okay. So as a consumer, then, I should really pay attention to that consultation process, because as you know, a lot of times they offer a complimentary one, but from what we hear sometimes, it's a quick consultation. I don't know if I'm really getting exactly what I need. So just so they're informed, how long should a consultation usually take if you're brand new to that med spa?
Almost an hour.
Okay.
Almost an hour, and its education is key. Mm-hmm. And we talk to them. We use a Visia, which is the skin analysis program. Mm-hmm. We show them exactly where their skin is right now. We can print out that their report, and they can actually have that to refer back to. But education is key. Mm-hmm.
Now, you mentioned that it's very important that they meet the providers. Now, there is a big myth in our industry sometimes, and consumers are not really aware, because this is medical aesthetics where you're really performing medical treatments, though sometimes people, other places, may not have medical professionals. So what would be some of the important things a consumer should be asking to make sure that you have medical professionals actually doing those treatments?
Really take pride in when somebody calls in and they have questions, or it's their first time here, and credentialing our providers. And the questions they should be asking is, how long have they been here? How long have they been giving the treatment? And we do have experts. Continuing education mm-hmm. is something that's very big at Aestique. So whether it is going to courses to get more hands-on training for more cutting-edge ways to deliver the injection, or now in times of COVID, doing some more Zoom types of trainings, those kinds of things. And even telling them they do 50 to 60 Botox patients a week. That's a lot. Mm-hmm. With dermal fillers, I think that's the most important thing, to know that they do it often.
Would you say those are the most popular treatments, Briana, the Botox and fillers?
Botox and dermal fillers are definitely the most popular treatments. Yeah. I mean, I now that we're evolving more into going into more of a medical spa, when our injectors are treating them, there's so many other things with the skin. So we're lucky that we can evolve into skincare and lasers and things like that mm-hmm. that are becoming much more popular. Yeah. So they can really take care of the whole face. Mm-hmm.
Absolutely. And that's what everybody's looking for. I was reading some statistics the other day, and it's amazing to me that about 61% of people now globally, this is global statistics, and that people are open to having non-invasive treatments. I think that's amazing that many people are running to a medical spa to get those kind of treatments. It's very exciting, actually.
It's very exciting. And I think people nowadays, it's more accepted than it was years ago. It's almost like, why aren't you having Botox? Why aren't you having, lasers for your face?
Yeah, everybody should. You have to look good. Actually, the other part of the statistic that I was reading the other day was that another 50-some% of people feel that they are more likely to be successful when they look good. And I think that's just so true, because if you don't look good, then you don't feel good, then you won't perform up to the level that you want to perform. So I think you guys are doing such a great service by your consumers, because you're truly helping, everyone as a whole, not just their appearance. So I think that's amazing.
We actually had a client come in not too long ago, and with everything going on with COVID, her position was eliminated. And she's mid-50s, and she said, I have to get back out in the job market, and I'm competing against people who are 30s and 40s, and I'm on these Zoom interviews, and I just don't feel like I look good. And she came in, we did the consultation. She had lots of great skincare, facials, Botox. She landed a great job, and she's super happy. So there are a lot of people now that are looking more into it, and it's much more widely accepted.
Yeah. Well, that's another question I wanted to ask you. Are you seeing a wide range of ages of people, including men? You're seeing more and more younger people. Who are those people that are coming in and getting treatments in medical spas?
We are seeing more men, and a lot of this has to do with Zoom. With everyone being on Zoom for the past year, everyone's looking at themselves saying, well, I've got to do something now. Our plastic surgical practice has really been booming with facelifts, blepharoplasties, because people are looking at themselves all the time. We see all ages. We see a lot of mothers are now bringing their younger teens in to start the proper skincare on their child, when they're starting with puberty and acne, and instead of waiting until you get into a full-blown issue, start early on. And we're seeing that, and we see 85-year-old women coming in for facials, for surgical, and for the non-invasives. So it's an exciting time.
Yeah. Well, that's what I love about the business that you guys have, is the fact that you can take them to a certain level, and that's really the topic of our conversation here. Is so you can go so far with non-invasive treatments, but then you do have to make the leap over to plastic surgery. So what is your philosophy, or what is the process that you guys believe in, that you take people through from non-invasive to actually go to plastic surgery?
You have some clients who really don't want any surgery for a number of reasons. They don't feel comfortable with anesthesia. They don't want the downtime, and they're perfectly happy taking themselves to the level, which is the highest level that they can get. You have other clients who say, I want to forget the injections. I want to go straight to surgery because I want a facelift that will last me, 8 to 10 years, and then complement it as you go on with Botox, with fillers as you need it. But our providers are excellent at working with the clients throughout this whole process. And once you get to the point where you're doing fillers rather consistently, and they're seeing results, but their skin is not really being lifted. It's being plumped a little bit here and there. It's not being lifted. And the only real way you can do that is surgically. And that's whenever they pass them on to the plastic surgical practice. Once they have the procedure, we still work with the spa, because you want to maintain healthy skin. And, after a couple of years, if you need a filler, you have a filler.
Yeah. And what age group are you looking at? Is there so for a person like myself, you're starting to lose elasticity. So I know you have a bunch of non-invasive or skin tightening, you have fillers, you have resurfacing, you have all kinds of things that you can do. But when is that leap? When do you actually make that transition?
It's really dependent on the patient. I mean, the goal between both of the practices is to help people feel their personal best, whatever that may be. And facelifts 10, 15 years ago, people were 52 to 62 having them done. Now you're seeing more people that are in their 40s having it done. So it really depends. We have such good autonomy with the providers in the medical spa and Dr. Lazarro that they work together, and often they will get together, show pictures of the client and say, okay, I can do this non-invasively, but I think you could do this better, and help them in a way that they're probably looking for. And it's a really good synergy between both. And then we'll let the patient decide if they want to stay non-invasive or if they maybe want to have something a little more aggressive done.
And what are you seeing as some of the most popular plastic surgery procedures?
Definitely number one right now is fat transfer. Autologous fat transfer. We do it anytime we're doing a facelift, even a lipo procedure, that'll usually happen. And what that means is that's taking fat from somewhere that you don't want it and you put it somewhere where you do want it, which great idea.
Yeah.
The nice thing about it is when you're having a facelift, you can put the fat lower lids and mid face and just help get that heart shape restored and what's a natural looking appearance. And with the fat transfer as well, there's a stem cell effect. So you see these clients, these patients' skin, and they just have this amazing glow to them. That's really become the number one. Of course, breast augmentations are always so popular. And now we're seeing more and more liposuction patients because the gyms were closed last year. So we're expecting an uptick in that to come in.
Very interesting.
Yeah.
So a facelift is something that usually lasts someone how long? Let's say somebody does a facelift when they're either 50 or 60, or like you said, sometimes even earlier. What would be a good, like you said, you would combine it with some other non-invasive, but what should be like the life expectancy of a facelift?
If you do the traditional facelift, 8 to 10 years. If you're doing, they call it quick lift or suspension lift or something, that really is about a year, a little over a year. So there's a big difference between the surgical procedure itself.
Okay.
We do offer mini facelifts too now, which is more like a 5-year. That's nice because it kind of corrects around the mouth and a little bit on the jawlines. And if people don't want the downtime for that, then they'll opt to do a thread lift, and that can last a year.
Well, that's the thing I think that's making non-invasive treatments also so popular, is the lack of downtime, where if you had a facelift, then you do need to take a little mini vacation, I guess, right? With the non-invasive treatments, I mean, everything can be done at your lunch hour now, right?
Yeah, just about. Yeah.
You go in looking one way and you come out looking another.
That's the nice thing, though, having a medical spa and a plastic surgical practice, because really with almost everything, you could do something non-invasive, like Kybella, if you have a little fat under here, or you can do a liposuction. You could do a chemical peel that's really aggressive to resurface your face, or you could have a laser in the med spa. So it's nice because it complements, just depending on what people want.
Yeah. Well, I love the fact that I would have one location that I can go to and be able to really take care of all my needs. It's so nice. Instead of being referred out to a plastic surgeon, you have everything right there in one location. And I have to say, I've had the pleasure actually to visit their location. And if you guys have not seen Aestique yet, you really must. It's absolutely beautiful. Their surgical center is amazing. Their med spa is beautiful. They have a great team. So I would highly recommend you stop by and visit. As a matter of fact, you have such a great team that people drive and fly in to come and see you guys. So how, and you both, your moms, your grandma, Lynda, you have kids, you have a business, you have husbands. How do you guys juggle all this? You're like Wonder Women.
It's 24/7 many days. It's like 24/7. But we spend a lot of time, in the evening or on the weekends, where we just have to talk and we regroup. The three of us to keep everything on track. And we do have a wonderful team in all three of our corporations, the surgery center, the private practice, and the spa. So we're very, very fortunate with that.
Very nice. Well, it says a lot about you guys when you surround yourself with great people. So let's go back a little bit to the teenagers with acne. Do you have some kind of like a VIP program where they come in on a regular basis? Because I know that when my son was going through that, one facial here and there was not enough. I really had to focus on him clearing up all the skin. So what kind of program can a consumer come to you for to ensure that my son or whoever's children they have are going to get the kind of treatments that they need?
We have a great membership program. It's called Aestique Elite, and there are 3 different levels. And a lot of times when you're thinking of millennials or even younger with the teens, the classic membership is fantastic. It's $159 a month that you bank, and we can develop a treatment plan for them to help target whatever issues they're having. If it's acne, we can do acne facials. Sometimes they might need a microdermabrasion. There's lots of different possibilities, and we make it really easy. So we get everything teed up, planned out, and the moms like it too, because then they can come while their son or daughter's having a facial and they have one in the next room.
Right.
So it makes it nice.
Now, the one thing I had to beg my son actually to use was the skincare products at home. So do you have certain things that you recommend to where they need to do this, yes, in the medical spa, but then they need to do this at home? Do you have like a whole regimen you recommend to them?
Absolutely. We have Zeo Skin Health, which is hands down, we think, the best medical grade skincare line. And it can help anybody from younger kids to teens, all the way into if you're looking for anti-aging, aggressive anti-aging. But 80% of what you do is at home. So we really take pride in recommending a good skincare program, and our experts are coaches, and they'll follow up with them and make sure that everything that they're doing is working. They might need to tweak something. But yeah, we do have great skincare lines that we can customize for
That's
them.
very nice. I remember those days. It's such a difficult thing that teenagers have to go through, and it does. It works on their self-confidence, and it's definitely an important thing for them to go through, for sure.
Just a little funny story about that. I have a 7-year-old daughter, and she wears a mask every day to school. And she was getting this contact dermatitis, and it almost looked like she was getting these little pimples. And she would come home and say, "Mom, what can I do?" So I have her started on a gentle cleanser, and sometimes we do like a little mask just to have some fun, and it's great. It works well, and hopefully she'll stay on that, not doing what I did and do tanning beds and things like that, and stay on a good skincare.
No
trend.
tanning beds.
They're so bad. So bad.
Yes, come to Boca instead.
Yeah. Natural
Have
vitamin D.
natural sun.
Yeah.
That's always better, that's for sure. What advice do you have for someone that, they're starting to notice the changes in their skin and they just don't quite know what to do, their appearance, they're starting to feel like less confident about their appearance? What advice do you have for them?
We would encourage them to come in and to do a customized consultation so that we can educate them and they can find out what options they have, and they will determine how aggressive they want to be or not. And sometimes you just have to start with the consultation process, and then they'll do a facial. And then after a few facials, they are saying, okay, I'm ready to try something else. You just have to work with them, and it's baby steps for a lot of people.
Yeah. Or they want everything done yesterday, right?
Exactly.
Or I want to reserve a plastic surgery right now.
There are people like that, yes.
I'm sure there are. I'll be one of those probably. Like you look in the mirror and after a while it's time to do something different, right?
Enough, I'm ready.
Yeah.
Yeah.
How do you manage expectations? I would think that would be one of the probably difficult aspects of having both, really, the plastic surgery and the medical spa. Because sometimes people may think like, oh, I'm going to look like, Angelina Jolie. Or whoever's in these days. Who's really in these days?
We actually had somebody come in and ask if she could change her face to look like Angelina Jolie. So that was a good example. But you're right. You have to be able to manage it. And in both practices, we really want to take the time to sit down, have that consultation, and really educate them on what it can and can't do, because it's not magic. So some things that they want, it's just not going to take them to that type of a level because it's not realistic. Mm-hmm. So education's big. Definitely.
So do you have to remind them, like when you take, like when I go to a medical spa, they always take before and after pictures. It's almost like I hear some conversations sometimes taking place. It's like they forget what they look like, before. And you have to almost remind them, like, okay, this is what you looked like before. This is what you look like now. Look at the differences, because they forget, right?
They do. That's very common.
That has to be a part of the whole appointment when you have that, because they do definitely forget. We have, the modality of the Visia skincare analysis for the spa that can manage, the expectations. But we also have in the plastic surgical practice something called Touch MD, where they can look at before and afters, and you look at someone who wants a aggressive facelift, or you want someone who wants just a very modified, simple, where you really can't tell, but the patient knows, the client knows. So you just have to show them those photos and keep showing them their photos after each process.
Yeah. Okay, so that's good. What, as far as the clients that are in your community, would you say that most of them come back? Like, how often would a consumer have to come back to a medical spa? What's the habits?
We really try to create the habit of having them come in once a month. We have great membership programs that they can utilize a lot of the different things that we have to offer. Botox is every 3 to 4 months, but you still need to maintain good skincare and get facials. So we really try to help create the habit for them and have it be like a 4 to 6 week period that they're coming back. And most of them do, and they love it. Our whole goal is to have a Ritz-Carlton atmosphere with a Disney experience. So we really take pride in becoming their friend, and they love to be here. So. Good thing.
Well, I would think the more you come, the less damage you do, more preventative care, I guess you would do, right? So I think that's a key, because I know that I'm getting to the age now where I have to do more to maintain, and I'm sure a lot of people are in the same boat. So if you stay away longer, then it's going to take that much more. So I love the idea that you have that VIP program and that people can come actually and maintain on regular basis, even if they just come in and get a hydrofacial, right? Or some kind of a peel or a facial. It makes a big difference.
It does. We talk a lot about prejuvenation and rejuvenation, but a lot of times people will come in and they'll sit at the Visia, and it's like, your skin didn't get like this overnight. It took a long time to get here, so let's get a good plan together. And people's results are great. We've got a good team and really great treatments and services to offer.
And it's very nice.
Yeah.
So the consumers that are in your area, what would you tell them to invite them to come and see you or come and experience Aestique? What would be some of the things that you can do for our viewers? If they mention Meet the Experts, what can they receive something special from you guys to come in as a first visit, maybe? Nothing like putting you on the spot, right?
Absolutely. They can come in, and we would love to have them sit down with one of our experts and have a customized Visia analysis, and we'd love to offer $25 to go towards a service for them.
Nice. Thank
Yeah.
you. That's very sweet. So
Yeah.
you guys call Aestique or go to their website, and I'm going to let you give the information where you want them to go. And then you'll be able to redeem that nice gift card and go and experience really wonderful team, wonderful space, and be able to get the kind of results that you're looking for. So where can they go?
You can go to www.aestique.com. You can also email spa@aestique.com, and that usually will come to me, and I'd be happy to answer questions and get you scheduled to come and see us.
Nice.
We do have a very good library on YouTube. Our YouTube channel is Aestique Medical. Lots of great webinars and content. If you're interested in anything, please go look at that. There's a lot of great stuff to see and learn.
And you get to see the facility too and what it looks like. They have a great website. And just so you know, Aestique is spelled Aestique. And we'll put it also below this video so you guys can go directly to that page and be able to redeem your gift card. What other last minute advice can you give somebody who's listening to us today?
I think if you're thinking about coming into the med spa or coming to see the plastic surgeon, do it. Come in, have that visit, see what we can do to help you. And it's not scary. Some people are a little afraid by it, but we're really warm and inviting, and we have great things to offer. So take that leap.
Very nice. And you, Lynda?
I would just say the same thing. I think when they walk onto the property, I think you feel special when you walk on our property. I think the employees, the staff, the team embraces you, and they make you feel comfortable. Mm-hmm. We don't pressure anyone to have something they don't want. A lot of times people can just come in and just simply have a consultation, and that's all they want in the beginning. Mm-hmm. But I think you need to just take that first step, and I think you'll see that we really do make you feel comfortable. Mm-hmm. And we try to answer all of your questions and help you along the whole way, the whole process.
Yeah. Well, I love the fact, again, that they don't have to start with anything huge. You have so many different treatments that they can take those baby steps that you're talking about, or they can go all the way. It's up to them. But having that kind of a menu where you can just come in and get Botox or fillers, or like you mentioned, you can do the Kybella or the lasers, such a wide range of opportunities to really help you feel better about yourself, because at the end of the day, that's really what this is all about. And I have to tell you, you are so right about the Zoom effect. I think we are hearing the medical spa industry is growing exponentially because so many people are not liking how they look. First, it was the selfies, right? That was the big boost for our business, was the selfies at first. Now it's Zoom. And it's truly, when you sit and you stare at yourself in that screen and you don't like what you see, it's like you need to call Aestique and see how they can help you. That's the way to go, right?
Absolutely.
Absolutely.
That's our motto. We want to help you live life counterclockwise.
Yes, and I love that, by the way. Thank you for sharing that. What a great way to end this interview. Thank you so much for both of you for being with us today. And if you want to learn more about Aestique, please visit their YouTube channel. Check out all their videos. Go redeem the gift card that they offered so generously. And I look forward to seeing you on the next Meet the Expert. Thank you so much for being with us, and we'll talk soon.